Wow, that's kind of interesting music, Ralph.
Yeah, it kind of goes with our theme for today, Jim.
Okay. Let's see. You mean psychedelics?
Psychedelics, yeah.
All right. I see that we're kind of blasting people a little bit with our modulate with our speakers. We'll
So
try and remedy that.
we'll try and talk a little more quietly.
Okay. Well, this is Jim,
And Ralph.
and we're saying welcome to Psychology Takeaway, where we attempt to look at current events in the world of psychology and relate them to what might be going on in your life or the lives of other people. And we mentioned psychedelics. Last week we had our first session with psychedelics, and I've thought a lot about it. I've talked to some doctors in the last week or so about the uses of psychedelics, and one doc that Sheila and I talked with is Doc Sanborn from Midland, and he said, people are about 50 years too late looking at psychedelics. And he said, if we'd started to really appreciate their potential, and I think we said this last week, back in the 1960s, we probably would have been a heck of a lot further along with some of our treatment modalities for severe psychological disturbances.
Yeah, and part of that, of course, was Tim Leary and Ken Kesey and people like that who were using these things recreationally. And what should I say, that took away from the serious possibilities of using psychedelics in therapeutic and general health usage.
Mm-hmm. Although people like Ken Kesey and Tim Leary would have said that even if there was no therapeutic spin-off, that just the idea of becoming more aware of your world would have been worth it.
Yeah, and I think there's a certain element of truth in that, although I would like to think that maybe what should we say, the becoming more of your world through meditation, through yes, transcendence,
like we did a couple of weeks ago.
That kind of thing is much more likely to lead to long-term good effects. Now, one of the things, Jim, that we tend to think of when we're thinking of psychedelics is mental changes, improvements, awareness, that sort of thing. But there's a post that came from Michael Kim and Robert Mueller, a couple of doctors, that are talking about treating eating disorders and using psychedelics to treat eating disorders.
Well, okay. I've just turned the volume down. I think I might have turned it down too far. So let me fool with this a little bit more, Ralph.
Okay.
Now, the thing about eating disorders is that they're very, very difficult to treat.
Yeah, and
successfully.
We tend to think of eating disorders as people walking around who are exceedingly thin for their height, or people who are walking around and they're exceedingly round for their height, and that's their business. And but it turns out that
anorexia is a killer, Ralph.
Yeah, it is. It has the highest mortality rate of any mental health condition. And obesity has not been directly linked like anorexia has to early death, but certainly obesity is very hard on the heart and lungs, and people are much more likely to become diabetic if they're overweight. So all of these things are genuine health concerns.
Yeah.
Can they be treated with psychedelic assisted therapy? Now,
So that's the question that these guys are raising.
raising, yeah.
Okay.
And the thing is, I want to emphasize to our listeners that this is psychedelic assisted therapy. So you have to have a therapist.
Okay.
It's
And as
not
we
just,
talked last week, that can be a clinical psychologist that's specifically certified, or it can be an MD, right?
right.
Okay.
And the thing is that we're not basically talking about, Tim Leary's tune in, turn on, drop out, just take this stuff on your own. We have to have a clinician who is prepared,
A supervised setting,
a supervised setting,
and somebody with specialized knowledge, right?
right? And so we look at some of the things that we've used psychedelic assisted therapy for, and they're all kind of difficult conditions to treat.
Well, we talked last week about PTSD,
Right,
which is very,
PTSD,
very difficult.
major depressive disorder, substance use, obsessive compulsive disorder, and treating eating disorders.
Okay.
So now, the thing that we have to maybe look at is that, we have in small groups looked at PAT treatment and found that it can be linked to positive behavior changes.
Okay.
But
That's because it's these behavior changes have to do with probably a neurological condition. And one of the things that we put up last week under Learn World was your brain under LSD. And I don't know if you looked at that, Ralph, but it showed your brain in a schematic drawing of
yeah,
in kind of normal awareness. And then with LSD, there were a lot more connections to a lot more places in the brain. So
right.
that there's much more neural activity, and hopefully some of that neural activity is hitting the areas that are important.
Yeah, and one of the things that people who specialize in this are saying is that these medicines, psilocybin, ketamine, MDMA, that these are really a catalyst for the process of healing, change, and growth rather than treatment itself.
Okay.
So, somebody who's taking a drug for diabetes, they might be taking, let's say, metformin, which is common in treatment.
Okay.
That drug itself acts on the pancreas to cause it to be more efficient.
Okay.
Okay. Now, nothing in psilocybin causes a person who's taking psilocybin to automatically cure their condition.
Okay. So
But
what's
it
the
is,
connection here?
yeah, it is a catalyst.
Mm-hmm.
So it, as you said, it magnifies the connections in the brain to different spots than are usually connected. So it's a catalyst for healing, change, and growth.
Okay. Now, if we have somebody who has an eating disorder like anorexia, they're starving themselves because they want to obtain or attain a particular body type.
Okay.
Okay. So they don't want to give it up. They don't want to give up their pursuit of this idealized body, although we know that there's nothing that's ideal. And we
Yeah.
also know that once you get to satisfy one pursuit, there's always another one there, right?
Right.
Okay. But so the psychedelics are going to increase the individual's awareness that what they're searching for is basically unrealistic? Is that what you're thinking?
That seems to be some of what happens. And the other thing is that one of the terms that's used in psychedelic treatment is the hero's journey.
Okay, Joseph Campbell's book of the same name.
Yeah. So if you go on a hero's journey, that means you go on quest for something.
Mm-hmm.
And the quest might be to say, who am I and do I like myself?
Mm-hmm.
And many people who are in this kind of obsessive look for the ideal quote unquote body are people who don't seem to like themselves very much as they are.
As they are, yeah.
Now, if we look back, for example, let's go back to perhaps the 50s and 60s.
Okay.
Marilyn Monroe, Jane Russell. Okay. Two well-known film stars from that era.
Right.
Right. Both of them had bodies that in today's world, particularly in today's fashion world, would be thought of as terrible.
That they, how so? They were overweight?
They were overweight.
Mm-hmm.
Marilyn Monroe.
As a 12 or 13-year-old looking at a Marilyn Monroe picture, I don't think I would have considered her overweight.
No, you wouldn't have. And, her measurements are well known. She thought it was thought at the time to have the ideal woman's body, 36, 24, 36.
Uh-huh.
Bust, waist, and hips. Now, today, if you were a fashion person, you would say, no. She was 5'7".
Uh-huh.
We look at these models, and the average is 5'10". Some of them are well over 6 feet, and the average weight is about 110 pounds.
Okay.
That's seriously thin, even for a woman who's 5'10".
Okay.
So you say, okay, well, suppose you're a woman who has 36, 24, 36 measurements. In today's world, you think I'm fat.
Yeah, I'm just walking away here for a second, Ralph, and I want to get a piece of paper because I sometimes forget what to put up on Learn More. But there was an interesting TED Talk by Cameron Russell.
Okay.
It's one of the TED Talks that is the most popular TED Talks of all time. She talks about her experiences as a fashion model. And there's another TED Talk that I think we're going to be able to try and find, and that is the physiological aspect of eating disorders.
Okay.
So go ahead and talk about the hero's journey, because usually there's some sort of a wound here, isn't there?
There is. And the wound might be something that's simply caused by living in the society we live in. And measuring yourself against who is the current image of the good-looking female or the good-looking male. And one of the things that we know is that if you go off in quest of the Holy Grail, quote unquote, whatever it is, whether it's the perfect body or the perfect, what would we call it, movie star male image, that the chances are pretty good you're going to fail.
Yeah.
Like.
Well, part of that, Ralph, is we get older. You no longer look like a famous movie star. Well, maybe you look a little bit like Sean Connery at this point.
Well, I think more like Elvis.
Elvis is dead.
Exactly. And the thing is that we look at these kinds of things and we say, okay, well, you know, you're never going to reach your goal. So it might very well be that using PAT, psychedelic assisted therapy, that we can come to terms with the fact
With
that
the unreachable goal.
with the unreachable goal and with the fact that basically most of us are pretty good people and we like ourselves or should like ourselves, and we come more maybe under terms of psychedelic assisted therapy to say, you know, I recognize that I am a worthwhile person, just as I am. I don't need to. I don't need to be truly thin, or I don't need to, weigh 300 pounds and look like a football player. I'm okay.
You don't need to buy a particular highly touted toilet paper these days in order to feel okay, Ralph.
I don't know,
Okay, yeah.
and one of the things, Jim, that we're also finding out that's kind of interesting. Um, Tim Leary, when he was dealing with psychedelics back in the 60s, he was using lab derived things.
Yeah.
And we now know that, for example, we have lab derived psilocybin.
Right, but is also some that's organic, right?
Right. Psilocybin comes from a certain variety of mushrooms.
Mm-hmm.
Now, the thing about the organic is that the mushroom extracts exhibits more potent and enduring effects on synaptic plasticity, which is what we're talking about when we say the multiple connections.
Yeah.
So the organic is more effective than the synthetic. And, in today's world where everybody is saying, hey, I eat organic, I go for truly organic growing things in the market.
Hey, I go to the
Co-op.
co-op, and they've got organic wine, which is kind of a oxymoron there, I think.
Yeah. So one of the things we know from the organic psilocybin, it enhances neuroplasticity. It creates metabolic profile differences, which basically means that it has influence on oxidative stress and energy production pathways. And it can be controlled in the way you raise the mushrooms.
Okay.
So, those of you who are saying, well, I don't want to take a synthetic lab derived stuff, well, organic psilocybin may be for you
Okay.
if you decide to use psychedelic assisted therapy.
Yeah. Your doc will talk to you about it, and I'm sure that the push will be toward the synthetic, but I think if you push back, your doc probably will be able to find some organic substances.
Yeah. Now,
you started here, Ralph, talking about the hero's journey. Okay?
uh-huh.
I'm sorry that Sheila hasn't come into the studio here to talk about the hero's journey, because she is kind of an expert on it. But my understanding with the hero's journey is that the hero does go off in search of the Holy Grail, but then has to return home, and
Right.
returns home a changed person.
Right. And that's the thing that the upside of psychedelic assisted therapy is that you go off, maybe you decide that the quest that you've been seeking, the Holy Grail, is going to remain perpetually elusive, and you'll never find it.
Like a mirage.
But then you
distance.
always in the distance. And then you come back home, but you come back home changed.
So, as opposed to conventional therapy, where drugs are used to help sort of stuff the feelings that a person might be dealing with. The what do you call it? PAT?
Yeah, psychedelic assisted therapy.
Yeah. Well, maybe Leary was right. Maybe it expands, the consciousness, and it does really help for positive behavioral changes, right?
Yeah, and as you said, the conventional therapies, often therapies that are assisted by drugs, what happens is that the real inside feelings just get numbed. They get stuffed down. Where with psychedelic assisted therapy, maybe they get brought up to the conscious level and examined and rejected.
Mm-hmm. Okay, now you and I are not licensed therapists. We're not licensed to administer psychedelic drugs, and we're not even pushing it. What
No.
we're doing is we're presenting the idea. This research is now coming out, and it seems to have some merit. So, if you are experiencing some sort of really debilitating condition like depression, PTSD, eating disorder, talk to your healthcare provider, and if they don't have an idea of how to go forward, they should be able to help you find somebody else who will.
Yeah, and remember here, and it's kind of important for us to say that neither of us are users or advocates of psychedelics, because we're not pushers here. We're just saying, hey, the research now, and remember, this is Psychology Takeaway, where we try to make the research available to the ordinary person. The research now is showing some promise in this area.
Okay, well, that's interesting, Ralph. So until next week, this is Jim
And Ralph,
saying keep your stick on the ice.
because we're all in this together.